Hello, good people. Good morning and welcome to my video talk show today. And today we are going to talk about one of the conditions or conditions that normally people get confused about on terms of the differences and the similarities. So today we want to talk about one of the conditions called STI and the UTI. We want to talk about how to notice the differences and the similarities between these two conditions. Many times when patients come to the hospital, they normally present with some symptoms, and sometimes they are not able to differentiate whether they are having an STI or they are having a UTI. So straight we are going to define the two conditions, and then we shall engage on the differences and the similarities. So when we talk about a UTI, we mean an infection that normally happens along the urinary tract. When we talk about urinary tract, here we are talking about all the way from the kidneys down to the ureter, down the urinary bladder, up to the urethra. That's what we talk. That's what we call a urinary tract. So any infection that happens along that tube or tract, that is what we call a urinary tract infection or UTI. And then when we talk about STI, here we mean all conditions that are transmitted through sexual contact with an infected person for this case. So if there is any infection that can be transmitted through sexual intercourse or sexual contact with an infected person, then we call it an STI. Sometimes others call it STD, that is sexually transmitted diseases. So having defined the two conditions, now we now engage on the differences among the two that will distinguish whether you are having a UTI or you are having an STI. And what distinguishes them is the symptoms, or rather signs and symptoms between the two. We shall start with UTI. One of the main symptoms of a UTI is what we call a burning sensation or pain while passing urine. So if you do experience such kind of pain, especially when you are passing urine, or a burning sensation for this case, it may indicate that you could be having a UTI. Another main symptom of a UTI is what we call increased frequency in passing urine. In medical term, we call this condition pyuria. So pyuria is basically an increased frequency in passing urine. However, sometimes it's normal to have an increased frequency in passing urine, especially in this cold weather. Also, if you take a lot of fluids, mostly which are caffeinated, you may pass urine in an increased way. This is very normal. But if it's abnormally high increased frequency in passing urine in conjunction with other symptoms, then it may indicate you could be having a UTI. Another symptom of a UTI is cloudy urine or turbid urine. So this is the color of urine that is not really good. So basically a normal urine color should be clear, although sometimes the urine color in the morning may not be such clear, but as the day progresses and as you take much fluids, the color of the urine is supposed to be clear. But if it remains cloudy, it may indicate that there could be a UTI. Also, another symptom is what we call lower abdominal pain. So lower abdominal pain, basically, which radiates to the back, it may indicate there could be a UTI. Another symptom is what we call blood in urine or hematuria. Hematuria is basically blood in urine or stains of blood in urine. Sometimes there can be just mild stains in urine, or rather mild blood stains in urine, or just a lot of blood in urine. So if there is, in any case you experience that, and there's no trauma which has happened, it may indicate that you might be having a UTI. So in this case, sometimes it could be all the way from the kidney, the likes of kidney stones, it could be bladder stones, it could be urethral stricture. Some of these things can cause blood in urine. Now let's talk about the symptoms which are specific to STIs or sexually transmitted infections. So in this case here, we talk about abnormal vaginal discharge, that is for women, and for men we call abnormal urethral discharge. So if you do experience this kind of discharge, it may be one of the main symptoms that you could be having an STI. Another main symptom is what you call blisters or some rash around the genital area. So when you talk about rash around the genital area, for women, it can be just around the labias. The labias, that's the vaginal lips. If you do have blisters around there, also around the vulva, it may indicate there could be a symptom of an STI. However, sometimes some people may experience frictions and the likes and experience such kind of blisters. But for men also, if you do experience blisters around the penis, around the shaft, it may also indicate there could be a symptom of an STI. Another symptom again of STI is what we call lumps in the groin. A lump is kind of swelling in the groin area. We call it a lymphadenopathy. Lymphadenopathy basically is the swelling of the lymph nodes. A lymph node swells basically due to a response to either inflammation or to a certain disease, basically bacterial or viral. It may make a lymph node to swell. Another thing is also heavy or painful menstrual cramps for women. That is, if you experience painful menstrual cramps which are associated with what we call dyspareunia. Dyspareunia basically is painful sexual intercourse. So you do experience painful sexual intercourse, which sometimes may come with bleeding. We do have some women who bleed after sexual contact. That is another topic maybe we may need to tackle some other day. But if you do experience such, it may indicate that there could be an STI for this case. So those are some of the differences between the UTI and the STI. So sometimes most of the people confuse between these two. However, we do have some symptoms which might be similar to both of these two conditions. One of the similarities is urethral discharge or pain while passing urine. Some of these conditions or the symptoms may be shared between the two. Sometimes low abdominal pain can as well happen in both UTI and STI. So having defined the UTI, STI, and the similarities and the differences and how to notice the differences, now we come to a conclusion. But before I conclude, we want to say that if you are not sure if you have an STI or you have a UTI, I encourage you to seek medical advice, especially when you have symptoms that you are not sure whether they could be for UTI or for STI. Just visit your doctor, explain to him or her about your symptoms, and then some tests may need to be carried out. Sometimes we may need to carry out tests like urinary Cs, HVS, that is a high vaginal swab for women. For men, sometimes you can as well do what they call urethral swab. We can also do tests for check for syphilis, that is VDRL, and or other STI screening, which can be able to distinguish if somebody is having a UTI or an STI. And once you've been found whether you have a UTI or STI, we always advise that you get treated and as well your sexual partner gets treated. It's very, very important that the two of you gets treated so that you avoid what you call a recurrence, or where a situation where one partner gets treated she or he gets sexual contact with the other partner, and then she gets or he gets reinfected again. And during the treatment period, we always advise that sexual contact is avoided for at least a week or so to allow healing for these conditions. So towards this end, I say thank you so much for watching and listening to my article today. And for those ones who have yet to subscribe to my YouTube channel, you can be able to do it. My YouTube channel comes by the name of CMO Dominic, as well as a Facebook page, the same name of CMO Dominic. You can always subscribe and follow my page so that you can be getting more information, more health talks, more medical teachings. Thank you, and thank you for listening and watching.